first U.S. patent for the reversal of aging, the Prolon fasting mimicking diet. Well, that very well may be the first patent for the reversal of aging. And in fact, if you look at the Prolon site, that's exactly what they say, and that's where Joel got that. I'm going to cover a couple of websites in this video that are focused on Prolon, P-R-O-L-O-N. I believe that comes from prolonged longevity. It's Valter Longo's mimicked fasting diet, FMD, fasting mimicking diet. The first website is from Joel Kahn. Joel Kahn is a cardiologist in Detroit. I know him and he's a delightful guy. He started off as an interventional cardiologist and got far more into prevention. May not have made him very popular with his peers, but did make him popular with a lot of folks. Joel is pretty adamant plant-based, and you'll see that in some of the website components. Kirk Hamilton is a PA. I don't know Kirk. He has a show and a website and does some interviews. The major reason I'm covering this one is that he does have a good interview with Dr. James Kelly. I spoke with Dr. Kelly a few times when I was getting started in the fasting mimicking Prolon activities. Now, again, major reason to go over these two is to just give you some reactions as I see these. Again, I'm a major fan of the fasting mimicking diet. I don't think that it walks on water, but we'll talk about that. You'll see some of the reactions as we go through. So this is Dr. Kahn's website, the first U.S. patent for the reversal of aging, the Prolon fasting mimicking diet. Well, that very well may be the first patent for the reversal of aging. And in fact, if you look at the Prolon site, that's exactly what they say, and that's where Joel got that. Why are they saying that it's the first patent? Again, maybe the first patent awarded, but does it do anything other than what fasting does? No, and we'll talk about that in just a minute. If food is medicine, can you create a food program so powerful in action that it can be patented for the reversal of aging? Again, getting into a little bit of maybe polemics there. This image comes from Longo's fasting mimicking stuff. As you can see in here, basically what he's pointing out is that, as he points out in his book, his career has been focused on not only humans, but starting with yeast and then mice, lab animals, to look at what happens in terms of fasting. You get similarities in terms of the metabolism in all of these animals. And the big hope, the big promise for adults is, or humans is prolonged lifespan, like you get with mice and with yeast, decreased diabetes, decreased cardiovascular disease, decreased cancer, and slowing down aging. Now, this goes on to point out the company, L-Nutra. Dr. Longo does not make a profit, or at least he says he doesn't make a profit from this product, and I believe him. He puts it into a charity. It's a 5-day plant-based food program. And again, Joel would want to get that plant-based in there. Now, why is it plant-based? Dr. Longo makes a point, and you saw it in, if you've seen my video on geriatrics and sarcopenia, some of the amino acids tend to stimulate plant or cell growth. Now, we're going to get into this issue of cell growth versus autophagy in several other videos, but here's the point with Longo's work. Talks about this as cell growth also does tend to steer the cell more towards diabetes, cancer, chronic diseases. So that's why Longo is focusing a little bit more on a plant-based components in the fasting mimicking diet. The FMD translates years of basic research in yeast and animal models to humans. That's true. And basically, the next components are true as well. The first day of the 5-day program is 1,100 calories, then 760 calories for the next 4 days. So part of the point with Dr. Longo was, again, he started off with fasting. His mentor in academics in LA was Roy can't remember Roy's last name. Somebody please help me. I hope you will in the comments. But he was in the bubble in the desert, where they had very little food for a couple of years. They got very thin and went on to show significant positive health impacts from that fasting, relative starvation impact. Longo started off mostly focused on jazz and music, and really did not want to get into all of the anger and emotion and frustration and pain that went along with his mentor's focus on caloric restriction, chronic caloric restriction. So what he said is, you know what, maybe there are ways that we can manipulate a diet that will give you the benefits of fasting without all the pain. There was another reason that he did this, and a very practical reason. He was working with cancer patients. And they showed that basically if you slow down the cell growth, the human cell growth, you can have a significant advantage in terms of chemotherapy. Because with fasting, you get slowed growth of the normal human cells. The cancer cells, however, cannot turn off that growth. The chemotherapy is always focused on the rapidly growing cells. So he was trying to get doctors to agree to have his cancer patients fasting. And they had a major problem with that. So again, he was focusing on trying to develop a diet which would help slow down cell growth for these cancer patients, so that chemo could focus on the cancer cells itself. The nutrients within back to the FMD, the nutrients are key, and they include plant-based whole foods like olives, teas, soup, milks, or excuse me, not milk, but olives, teas, and soup mixes that are about 60% fat, 10% protein, and 30% complex carbohydrates. And again, you get back to that point about protein stimulating cell growth. During the 5 days of restricted calories, exercise and alcohol are out. I did a little bit of each, and coffee is limited. So what's so special about it? I'm gonna just very briefly mention, yes, they've done some really good research, and you do see some significant decrease in weight loss, visceral fat loss, drops in blood pressure, blood sugar, which again you'll see with any type of fasting, blood cholesterol, markers of inflammation, and other biomarkers. Again, all of which you see with any type of fasting. Even more profound, I don't know that profound is a word I would use for this, but it's a very, very positive activity. Drop in insulin-like growth factor, IGF-1. Now, we're going to get deeper into the biomarkers of cell growth and autophagy in later videos, but yes, you do get a decrease in IGF-1, and IGF-1 is something that does tend to promote insulin diabetes. You get an increase in stem cell production, again, both of which, the IGF-1 and the stem cell production, again, both components of regular fasting. Like I've said multiple times, all of these things are things that you see with regular fasting. It's just a kinder, gentler way. And that's the major thing that I would say for mimicked fasting. I started off with mimicked fasting, did several different episodes of it, about 6 months, once per month for 3 months, and then once every 3 months for a couple more months, or a couple more cycles. That got my body hardened, and I got used to fasting, regular water fasting. At this point, I'm doing 2 days a week, not every week, but most weeks, of water fasting. As usual, I've been far more long-winded than I planned, because I got deeper into detail than I had planned. I think we're getting, again, fairly long in this video. I'm going to cover some other components of the interview with Dr. Kelly in a later video. If you're still here, thank you again for your interest. Looking forward to seeing you in Louisville, November 8th and 9th. Get all your labs, your arterial scan, spend time one-on-one with me, and 2 days of intense focus on how to prevent your heart attack, stroke, dementia, blindness, kidney disease, erectile dysfunction. Looking forward to seeing you there.